Hello and welcome to today's presentation, Transforming Care at the Bedside, Overview, Insights, and Lessons Learned. Facilitating today's webinar is Kenneth Dion, President and CEO of Decision Critical. I am now going to hand the presentation over to Ken for a look at our sponsors, presenters, agenda, and a brief introduction to today's topic.
Thank you, Richard, and thank you everyone for joining us today for our webinar. First of all, I would like to thank our sponsors, and that would be the Institute for Healthcare Improvement, Children's Mercy Hospitals and Clinics, MD Anderson Cancer Center, Sigma Theta Tau International, the Honor Society of Nursing, Robert Wood Johnson Foundation. In terms of today's agenda, we're going to be provided with a brief overview and introduction to the topic of transforming care at the bedside, and then we will have two case studies, one presented by MD Anderson Cancer Center and the other by Children's Mercy Hospitals and Clinics. And then finally we will wrap up with Q&A. And now it is my great pleasure to be able to introduce our speakers for today. Pat Rutherford is the Vice President at the Institute for Healthcare Improvement. She is responsible for managing IHI's clinical office practice redesign, improvement, access, and flow in the specialty of practices and outpatient settings, optimizing care coordination and transitions in care, innovations in patient-centered care, and the Robert Wood Johnson Foundation IHI initiative, Transforming Care at the Bedside. Dr. Beverly Washington is the Director of Nursing Programs at the University of Texas MD Anderson Cancer Center. She has served as the project leader for Transforming Care at the Bedside since 2004. In addition to TABC, she also works in the Evidence-Based Nursing Program and chairs the Institutional Falls Advisory Team and is also involved in the magnet redesignation and Joint Commission readiness efforts. Susan Widener is the nurse manager on Henderson 6 at Children's Mercy Hospitals and Clinics. She and her co-manager have been involved in Transforming Care at the Bedside initiative since 2006.